Well, welcome again. Welcome to Get Set Up special event, part 3, selecting and enrolling in your plan on time and penalty free. My name's Lee. I'm one of the guides here at Get Set Up, and I'll be your host this evening. As a community of active older adults who are looking to stay informed and connected, Get Set Up is thrilled to have Richard from CoverRight with us tonight to lead us in part 3 of this 3-part series, How to Navigate Medicare. Before we get started, I wanted to cover a few housekeeping items. During the first part of the program, Richard will be sharing a presentation. If you have any questions during this part of the program, you can put them in the chat so you don't forget them. The second part of the program will be where you can ask your questions. You can raise your hand, or you can ask your questions out loud and or continue to use the chat. I'll read the questions from the chat channel to Richard, and we'll do our best to answer all the questions this evening. And now on to our special guest, CEO and co-founder of CoverRight. Richard is the CEO of CoverRight, a content writer, a licensed insurance agent focused on Medicare. He is based in New York and is passionate about empowering consumers to take control of their health and finances. Richard has extensive experience working in the financial services with over 8 years experience in the industry. What is CoverRight? CoverRight.com is a digital-first health insurance platform focused on Medicare. The company's mission is to make Medicare more transparent and accessible for the 60 million American Medicare beneficiaries. Their mission is to simplify a traditionally confusing and complex decision by delivering you a simple, delightful, and comprehensive enrollment experience. This is the last of a 3-part series, and if you were not able to join us last week or the week before, we're happy that you've joined us this evening. We'll be covering how to avoid late enrollment penalties, select the best Medicare plan for your personal needs, enroll in Medicare with confidence. Richard, welcome to Get Set Up. We're so glad you're here with this evening. Take it away.
Thanks very much, Lee. I'm just going to share my screen here before we get started. Just want to make sure you guys can see that. Can you see that, Lee? Perfect. Well, yeah, thanks so much for having me back. Bit sad that it's the last of our 3 sessions, but been great fun talking to everyone. So tonight's session, we're going to be talking about enrolling in your plan on time and penalty free. So we just did the introduction to CoverRight. I won't redo that, but like Lee said, we are the first purpose-built digital concierge platform for Medicare, and so we're excited to be here to be able to help everyone. On today's agenda, we're going to talk about just recapping some of the different parts of Medicare. We had done this in the last couple of sessions, but just a quick recap for anyone who didn't join those. If you are looking for more detail, you can feel free to visit our website as well, just to look at some of the materials we have on the different parts of Medicare. And the key thing that we'll be covering today is that how to enroll in Medicare. Timing is everything when it comes to enrolling in a Medicare plan. There can be some very costly mistakes for not making your enrollment windows on time. And so we'll just cover what that is for the key enrollments that you need to know of. So the different parts of Medicare. As some of you may recall, we always have this left-hand side, right-hand side chart. Basically, there are 2 ways to get your Medicare coverage. The first is your original Medicare, which means this is the default government program. There's typically 2 parts: hospital part A, medical part B. And when you're in this option, there's a few things you can do. You can add a standalone prescription drug plan, and you can also purchase what's called a Medicare supplement or Medigap plan. And I'll talk about the pros and cons of doing this on the next slide. The alternate to that is a Medicare Advantage plan. Now, Medicare Advantage plans are provided by private insurers. When you sign up to a Medicare Advantage plan, you are proactively making the decision to no longer take your Medicare directly from the government, but you are now taking it from the plan that you have chosen. Medicare Advantage plans are all-in-one bundled alternatives to original Medicare. And what I mean by that is they typically come with the drug coverage in the plan. And they also come with extra benefits such as dental, vision, and hearing. And if you see advertisements on TVs, it's most likely the Advantage plan. Neither is necessarily better than the other. It depends on your situation and your preferences and your personal financial budget. But these are the two options that you can be in, and you can only be in one at a time. You can't have both the left-hand side and the right-hand side at the same time. It's got to be one. So what are the key pros and cons of doing each? So if you stay in original Medicare with a Medicare supplement versus a Medicare Advantage plan, the first key difference is doctor networks. When you're in the default government program, you can go to any doctor that accepts Medicare. That's 94% of doctors across the country. So there's no doctor networks, there's no specialist referrals, there's no need to select a primary care physician. On the flip side, with a Medicare Advantage plan, because you are taking your care from that plan, the plan can decide which doctors you can see. So there are typically doctor networks, and you need to use in-network providers in order to get the lowest cost coverage. And then some plans will not cover any out-of-network providers at all. The second pro and con is that with an original Medicare and a Medicare supplement plan, there are limited to no out-of-pocket costs. When you are in original Medicare and you purchase the Medicare supplement, what the Medicare supplement does is it helps to cover the gaps that are not covered in original Medicare. Basically, your obligations that you would otherwise have to pay if you were to stay in the original Medicare program. Which is great because it means when you go and use healthcare services, it will be covered by your supplement plan, which means you have limited to no out-of-pocket costs. On the flip side, a Medicare Advantage plan is pay as you go. And what I mean by that is you share in the costs of healthcare services throughout the year. So the plan will say you have to pay certain co-pays and co-insurances for a specific list of services. And you have to pay those co-pays and co-insurances up to the maximum out-of-pocket limit each year, which ranges, it depends on geography, but typically ranges between $3,000 to $7,000. So until you hit that cap each year, you keep paying for your healthcare services through your co-pays and co-insurances, which again is different to original Medicare with a Medicare supplement plan where you have limited out-of-pocket costs because the gap plan or supplement plan will pay for those out-of-pocket costs. Now, what's the con of being an original Medicare with a Medicare supplement? In order to get this comprehensive coverage, have limited out-of-pocket costs, you do have to pay an extra premium. That premium ranges from $90 to up to $300 plus. Depends on various factors such as your age, location, any health conditions you've previously had. On the flip side, Medicare Advantage plans typically have a $0 premium, which doesn't mean they're free. You still have to pay your underlying Medicare Part B premium, which in 2022 is $170. It just means there's no additional premium on top of that. Now, the reason for that is, again, Medicare Advantage is an alternate to your original Medicare coverage. So when you're selecting an Advantage plan, it's just a different way of taking your Medicare. So you still have to pay that baseline premium. And the last difference between the two plans is when you're staying in original Medicare, you don't get extra benefits. You have to buy a separate drug plan. And if you want dental and vision, you also have to get that separately. Whereas the Advantage plans typically will bundle the drug plan in as well as some routine dental and vision. So teeth cleanings, eye exams, and things like that. So both options, like I said, neither one is better than the other. It depends on your situation, depends on your health preferences. It depends on how you want your healthcare costs covered. To make a generalization, if you were to take the left-hand side option, what you're really doing is you're paying extra monthly premiums to have peace of mind that you don't have to pay for out-of-pocket costs when you use medical or hospital services. On the right-hand side, you're saving in terms of upfront premium But then, you in a good year, you don't really pay anything because you pay as you go. If you don't use any healthcare services, you don't pay anything. But in a bad year, again, because it's pay as you go, you'll keep paying for co-pays and co-insurances until you hit the maximum out-of-pocket limit, which could be between $3,000 to $7,000 or more. Just depends on the plan that you're signing up to. So it's important when you're selecting a plan to really decide on a path. There's a lot of details that you get into, but I think the first selection is how do you want your healthcare covered? And this is going to determine the relevant enrollment periods that you have to think about, which we're going to cover now. And again, if you want more details on any of these parts of Medicare, feel free to go to our website and we'll have that in more detail. So timing is everything when it comes to Medicare. You can't just enroll in Medicare whenever you want. There are specific timeframes, and timeframes are really broken up into 3 different and separate rules and regulations. And unfortunately, it doesn't make it easy, but it's important to understand that these are very separate timelines. The first is, when can you enroll in original Medicare A and B? In most cases, you're going to need A and B to enroll in any sort of supplemental coverage, which would include the drug plan, the supplement plan, or Medicare Advantage. So it's important to understand when you can get into that A and B for Medicare. The second is Medicare Advantage and prescription drug plans. Now, this actually crosses across both options, which is what makes it complex. However, the Medicare Advantage plans and the prescription drug plans have the same enrollment windows. And the reason for that is they're regulated under the same regulation. There's more complex reasonings behind that, but the key thing to know is when you're thinking about a drug plan or a Medicare Advantage plan, they have the same enrollment windows. The last is your Medicare supplement plan. Now, this is separate to your Medicare Advantage or prescription drug plan. The simplest way to explain why that is because Medicare supplement plans are true private coverage. Supplement plans are not subsidized by the government. When you buy a supplement plan, you're buying it directly from that private insurance company, similar like you would if you were buying home and auto insurance. On the flip side, there is some federal subsidization for the drug plans and the Medicare Advantage plans. And so that's why they go under a different set of regulations, and therefore they have different enrollment windows. So during today's session, I will be using the red, purple, and pink circles to help guide you and help you understand what is it we're talking about when we're talking about an enrollment window. And so I would pay attention to the circles if you can. So we just covered this, but just to recap, it's important when you're signing up to Medicare, you need to understand firstly when you can sign up to the underlying original Medicare A and B. Secondly, understanding when you could sign up to an Advantage plan or a prescription drug plan. And then thirdly, when you can sign up to a supplement plan. Now, if you've decided you don't want a supplement plan, then it's quite easy. You need to understand 1 and 2. If you have decided you want a supplement plan, you actually need to understand 1, 2, and 3, which can get complex, but we'll walk through it today. So, initial enrollment period. The initial enrollment period is the very first time that you can sign up for most people to Medicare. It's the 7-month period around your 65th birthday that enables you to sign up into that baseline original A and B that you need in order to get any other supplemental coverage. The 7-month period is the 3 months before your birthday. It includes the month of your birthday and lasts 3 months after your birthday. When you sign up during that period does make a difference. If you're signing up before your 65th birthday, so in this 3-month period, it will start on the first of the month that you turn 65. If you sign up during the month of your 65th birthday, it will sign up you'll start the month after your 65th birthday. And if you sign up 1 or 2 months after, the timeline actually extends beyond the 7-month period. So it's important to know that, because if you sign up later or after your birthday, you could have gap in coverage that you may need to cover with other insurance or existing insurance that you need to extend. So it's important to know when to sign up. During this initial enrollment period, the Medicare Advantage and drug plan enrollment window actually coincides. So what that means is it overlaps with this 7-month period. Once you have your A and B, you can sign up to a Medicare Advantage plan or a drug plan during this initial enrollment period, but you must have your A and B first and your Medicare number. So what does that mean? It means you need to do some administrative planning. And our recommendation here at CoverRight is always to plan ahead. The best practice is to sign up to Medicare before your 65th birthday. If you do it at the beginning of the 3 months, you will get your card, hopefully within the first or second month of signing up. And then during the second and third month before your birthday, you can sign up to the Advantage plan or drug plan. Make sure you plan appropriately so you have time in advance of signing up. What happens if you miss your initial enrollment period? It's really important to know when your initial enrollment period is. And the reason for that is there's late enrollment penalties. If you miss your initial enrollment period, you can't sign up until the next calendar year. And I'll talk about that in a few slides. But not having Medicaid coverage when you're 65 can cause you to have late enrollment penalties when you do sign up down the road. You may be asking, what are the penalties? There are two that you need to be aware of. The first is called the Part B penalty. So if you don't have Medicare Part B when you first turn 65, unless you have a valid exception, there is a 10% penalty for each 12-month period that you missed signing up for Part B when you were eligible. And these are lifelong penalties. So if you missed it for 2 years, it's 20%. You have to pay that 20% penalty for the remainder of the time you have Part B. The next one is the Part D penalty, which relates to drug plans. Again, when you turn 65, with limited exceptions, you have to have what Medicare considers a creditable drug plan in place. If you don't have a drug plan in place, you will be charged 1% of the monthly national base premium by the full number of months you had no coverage, which basically means 12% penalty for every 12 months that you don't have a Part D plan. So again, it's really important to make sure you know when your initial enrollment period is, because if you miss it, the penalties can be high, and also they are lifelong. They don't just go away. What happens if you're working past 65? So this is probably the only exception where you can defer Medicare. If you're working past 65, you can defer Medicare without any penalty if your employer who provides you medical coverage has more than 20 employees. If you pass that 20 employee threshold, then you are okay to defer Medicare until you retire. For the Part D or for the drug plans, you can defer your coverage if your employer's drug plan is as good as Medicare's coverage. Now, your employer is supposed to give you that notice each year to let you know if that drug plan is as good as Medicare's or not. And so it's important to get that notice. If you don't get it, make sure to ask them. And if your plan is not creditable, you do need to sign up to a Part D plan straight away. Otherwise, you will have penalties down the road. So we just spoke about what happens if you miss your initial enrollment period. When can you actually sign up next? So say you missed your initial enrollment period and it ended June 2022, which means your birthday was March 2022. And so the end of your enrollment period is June 2022. Say you missed it. When's the next time you can sign up? The next time you can sign up for Medicare A and B is during your general enrollment period, which is the first quarter of the next calendar year. So if it was June 2022, it would be January to March 2023. However, the important thing to note is when you join up during that general enrollment period of the next calendar year, the coverage does not start until July 1st of the next calendar year. So in this case, if you missed your initial enrollment period, you actually have a gap in coverage of 12 months that you're going to have to fill with some other type of insurance. You can sign up to a Medicare Advantage plan ahead of this July 1st start date. So normally you can sign up to that during Q2, which is April 1st to June 30th. So again, if you missed your initial enrollment period, you can sign up the next calendar year, January to March, for your original Medicare. You can sign up to a Medicare Advantage plan and PDP plan in Q2. And then that would mean you will have both your baseline Medicare and the supplemental plan ready for a July 1 start date. And you will be likely assessed a late enrollment penalty, again, because you didn't have Medicare coverage for 12 months. So main point here, don't miss your initial enrollment period. Don't defer Medicare unless you are eligible to defer without penalty. If you do miss it, you can sign up later, but as you can see here, you will be assessed a penalty, and more importantly, you will likely have a coverage gap that you're going to have to fill in before your Medicare kicks in. So we mentioned earlier that you can defer Medicare if you are still working. So obviously a lot of people nowadays are working past 65. Most people will defer parts of Medicare because they have work coverage during that period. So what happens when you finally decide to retire and you're going to lose your work coverage? You have an 8-month period to enroll in Medicare Part B, which is your underlying original Medicare. So when you lose your coverage, you have 8 months to enroll in Part B and contact Social Security. Typically, once you contact them, the effective start date of your Medicare is normally the first of the month after you apply for enrollment. When you're leaving work coverage, and if you want a Medicare Advantage or a prescription drug plan, you have to choose that plan within 60 days of losing your coverage. So that's really important, because while the underlying Part B, you have 8 months to sign up, you only have 60 days to pick a Medicare Advantage or prescription drug plan. So when we tell our clients what to do in this situation, we almost always tell them to ignore the 8 months. You should have everything in place within the 60 days, because once you miss that 60-day period, your options really narrow for your private coverage. So again, you do have 8 months. Our advice typically is to ignore that. Look at it as a 2-month window. So 60 days after you retire, get all your Medicare and Medicaid coverage in place so you don't have any issues when you're trying to select coverage. And given you've deferred Medicare because you have work coverage, you'll most likely not have a late enrollment penalty. But again, you have to meet those rules that we mentioned earlier. So that's medical coverage. Your employer has to be greater than 20 employees. And then drug coverage, your employer's drug coverage needs to be as good as Medicare's, and they need to give you a notice for that to let you know. So we've covered original Medicare. We covered, as part of the previous slides, your prescription drug plans and your Medicare Advantage plans in terms of when you could enroll in those during your initial enrollment period, as well as when you're leaving work. So again, your initial enrollment period is a 7-month period around your birthday. That's when you can sign up to original Medicare. You can also sign up to an Advantage plan or a drug plan at the same time. The windows coincide and overlap. When you're leaving work, you have 60 days to enroll in a Medicare Advantage or prescription drug plan. You have that 8-month window to sign up to B, but again, our advice is to ignore the 8 months, look at the 60 days. Now, we did mention earlier that Medicare supplement plans have a different enrollment window. And again, this is because they are regulated differently. It does get complex, but The reason why they are different is because they're not under the same regulation in terms of what the government oversees. So for a supplement plan, the rule is you can actually buy a Medicare supplement, also known as Medigap plan, anytime during the year. However, as I mentioned earlier in this session, a Medicare supplement plan is true private coverage. When you buy a Medicare supplement plan, you're buying private coverage directly from an insurer, like you would if you were buying home or auto insurance. And so therefore, in a normal scenario, that insurer can ask you health questions. They can underwrite you, which means they have to make sure you fit their criteria for accepting you into their coverage. And you can actually be denied coverage like you would if you were buying home, auto, or life insurance. So under a normal scenario, a Medicare supplement plan can ask you health questions and underwrite you. In most states, and this is really important, the only exception is you have one chance to enroll in a Medicare supplement plan without health questions. And that chance is a 6-month period after you first enroll in Medicare Part B. So for most people, this will be when you are turning 65 and you enroll in Part B, or it could be you're retiring and you're enrolling in Part B for the first time. During this 6-month period, you can buy a Medicare supplement plan with no underwriting, no health questions. The supplement plan has to give you a policy and they cannot charge you more than what they charge anyone else. So this is a very special period. It's really important to know if you are looking at that Medicare supplement option, because once you miss this period, in most states, you will have to go through health underwriting after that, which could mean you are denied coverage. You know, if you're healthy, that's fine. It doesn't really matter, but you could make it harder down the road to get into a supplement plan. And our big advice is don't miss this open enrollment period. This is the best period to get a supplement plan if you want one. And so again, make sure you know when this period is. It's 6 months after you first enroll in Part B, whether that's when you're 65 or that's when you're retiring and enrolling in Part B for the first time. So back to this slide. So we spoke about you can buy a Medicare supplement plan anytime during the year. But you have to go through health underwriting. The only real exception in most states is the 6-month period after you get your Medicare Part B. Are there any exceptions? Yes. The two ones that we see most commonly are what's called a 12-month Medicare Advantage trial right, what this is if you were in a Medicare supplement plan or in the first place and you decide to try a Medicare Advantage plan, you have 1 year to try that plan and switch back to the same company that you were on for the Medicare supplement plan if you don't like that Advantage plan. So it's called a 12-month trial right. The second exception is there are some states that have rules that allow you to get a policy. It doesn't mean you get it at the lowest rate necessarily, but it means you can get a policy, and that's called continuous guarantee. So New York State is one, Connecticut, Massachusetts. If you're in these states, an insurance company must give you a policy, but it doesn't mean they have to give it to you at the lowest rate. In any other state, if you go through and sign up for a Medicare supplement plan during the year and they underwrite you and they feel like you don't meet their criteria, they can deny you coverage. But there are certain states that have exceptions, New York, Connecticut, Massachusetts. And then in California, they also force the insurance companies to give you a policy 30 days around after your birthday. So each year you get one chance to switch to another company if you want to. Now, one important thing that I need to mention, as I spoke about at the beginning of this session, we have that left-hand side, right-hand side option. They're mutually exclusive. You are able to switch in between those at certain points during the year, but we have clients who go, okay, I can buy a Medicare supplement plan anytime during the year. I'm just gonna leave my Medicare Advantage plan and join a supplement plan. It's really important that you don't do that. And the reason is, if you leave your Medicare Advantage plan to join a supplement plan halfway through the year, you're going to need drug coverage. However, you might not have an enrollment window to actually enroll in a drug plan when you're doing it halfway through the year. So it's really important that if you are in a Medicare Advantage plan and you're looking to go into supplement, you only do it during the annual enrollment period, which I'll talk about in a moment. Don't just drop your Medicare Advantage plan mid-year and try and get to a supplement. If you do, you're going to have issues, again, because you'll likely need a separate drug plan and there's no enrollment window open for you to enroll in a separate drug plan. So again, Medicare supplement, it's important to know when your Part B start date is. Why is this important? Because you have that 6-month period after you first get Part B to get a Medicare supplement plan without any underwriting. And the second, again, if you're looking to get into a Medicare supplement plan, just make sure you understand if you're impacted by the drug plan enrollment restrictions. You can't just leave your Medicare Advantage plan. You need to make sure that you can actually get into a drug plan so you don't get any penalties. So you've enrolled in Medicare, you're in your Advantage plan or you're in your supplement plan with the additional standalone drug plan. What happens if you want to switch? So the one period where you can really switch any of your Medicare coverage is really the annual enrollment period. That runs from October 15 to December 7 of each year. And I'm sure, as many of you know, once you start running up to this season, you'll see a lot of things coming in the mail. You see a lot of things on TV saying that it's coming. This is the period, if you want to assess your coverage, to look at that and begin thinking about whether you want to change that for the next calendar year. So when you make a decision during this period, the coverage doesn't start straight away. It is for the next calendar year. So if you change it, it doesn't start until, if you change it at the end of this year, between October 15 to December 7, it doesn't start until January 1, 2023. What can you do during the annual enrollment period? You can basically do anything. You can, again, the red circle is the basic Medicare, the purple circle is your drug plan or Medicare Advantage, and the pink circle is Medicare supplement. So you can move from original Medicare with a supplement plan to a Medicare Advantage plan. You can go back the other way. You can swap Medicare Advantage plans. You can swap your drug plan, or you can get a drug plan if you don't have one yet. So this is the period, if you want to move between the left-hand side or the right-hand side of that page that we've spoken about, this is the period to do it. And again, once you make that choice, it doesn't go into effect until January of the next year. What happens if you made a mistake during that period? What now? So there is a period called the Medicare Advantage Open Enrollment Period. It runs from January 1 to March 31. And coverage, if you make a selection here, coverage goes into effect the first of the next month. But during this period, what this period is for is if you selected a Medicare Advantage plan during the annual enrollment period, so between October 15 to December 7, you decided, I want to go into a Medicare Advantage plan, or I want to switch my Medicare Advantage plan. That goes into effect January 1 of 2023, for example. You try the plan out and, someone told you it covered your doctors, but it actually doesn't. Or someone told you it covered your drugs at a certain cost, but it actually doesn't. If you are in a Medicare Advantage plan as of January 1, you have one option to switch out of that plan into another Medicare Advantage plan, or switch back into original Medicare. This is only applicable for people who are in a Medicare Advantage plan as of January 1. If you are on original Medicare with a supplement, you cannot switch into a Medicare Advantage plan, and you cannot switch drug plans. So that's really important. We have clients coming through asking us to switch plans or switch into a Medicare Advantage plan during this period. You cannot do that. This is only available to people who are on Medicare Advantage as of January 1 of the year. So that's really the end of the session in terms of enrollment windows and when you can switch, when you should switch, the key rules. If you're looking for more resources on Medicare, I know we had covered a couple of sessions before, but a lot of the information we had on the different parts of Medicare you can access on our website as well at learning.coverright.com. And feel free to come to check out our website. We give you a personal dashboard that you can go through. We give you instant, accurate prices, as well as a way to easily compare your plans, as well as ways to help you save on your drugs. So really encourage you to come to our site, visit coverright.com or reach out to me directly. And with that, I'll open it up to any questions. Might be on mute, Lee.
You're on mute.
You might be on mute, Lee.
All right, thank you for that. Thanks, Richard. We have several questions in the chat. I'll read them out. If anybody has any additional questions, please feel free to put them in the chat or just unmute yourself and ask the questions. So I'll go through a few of these. I'll also post up in the chat channel. We love your feedback. So we do have a feedback form for you to fill out if you'd like to give Richard some feedback. So under the Medicare Advantage, could I be limited or denied any services?
So yeah, on the Medicare Advantage plans, two answers to that question. One is you can't be denied entry into a plan. So one is, I spoke about the Medicare supplement plans, you can get denied coverage. So you can't get denied entry into a Medicare Advantage plan if you're eligible for Medicare. I think the second part of that question is probably more specific. Can you be denied services under that plan? The answer is yes. Again, when you go into a Medicare Advantage plan, you are agreeing to take your Medicare from that plan directly. So that plan can ask for prior authorization for certain services. For example, they may require you to get a referral from your primary care physician to see a specialist and things like that. And they do have the power to deny some services if they don't think that it's medically necessary or things like that. There is an appeal process, but that is one of the potential downsides of joining a Medicare Advantage plan, that the plan does have some leeway to determine what services you can and can't take.
Very good, thank you. Can COBRA be used to cover the first through the third month after my 65th birthday if you enroll after your 65th birthday? Sure, I understand that.
Yeah, I mean, if you enroll, well, I'll try to answer as best I can. If you enroll after your 65th birthday, there was a chart early on that I had where it would sort of say, if you enroll in the month of your birthday, it's going to start the next month. If you enroll 1 month after, it's going to start 2 months later, for example. So during that period before your Medicare starts, unfortunately, you will have to find some other kind of coverage. Now, typically people who proactively or decide to defer it to the end of that period, it's normally because either they have COBRA or something that they know is going to be in place to help cover that period. But if you don't have any of that, again, it's really important you sign up ahead of time.
There is a question, will the 3-part series be presented again, and when, please? We don't have it scheduled to be presented again, but you can inquire to receive a recording of the 3 sessions that Richard has done. And you can just do that by sending an email to help@getsetup.io, which I will also put into the notes section that you'll be receiving after the class here today, or a session tonight. So Again, that's help@getsetup.io, and you can just request Richard's series. Let's see. So I buy my first Medigap plan and they have to take me. I'm healthy, but then I really get sick. Can the Medigap people drop my coverage later or increase the premium?
Yeah, so they can increase premiums, and typically it will increase with your age, but they cannot drop you as long as you continue to pay your premiums. So the only reason a Medicare supplement plan can drop you once you have entered that plan is if you stop paying your premiums.
If I'm in a plan and I like it and I don't want to switch, do I still need to reselect a plan, or can I just do nothing if I'm content with the plans I have?
Yeah, that's a good question. So normally you don't have to do anything. And what will happen is coming up to that annual enrollment period around September, you should receive a letter from your current plan stating if there's been any change for the next calendar year. So the plans, even though you're in the same plan, some of the benefits can change. The carriers have an obligation to let you know what's going to be changing for the next calendar year. And so you will receive an explanation of that around September. I encourage you to read that. And then if you're happy with it, then you don't have to do anything. It will just roll over.
Great. The floor is open. So if anybody would like to ask any additional questions or has any comments for Richard, you can unmute yourself or just type it into the chat channel. All right. Well, thank you, Richard. It's been great having you here this evening to teach us about CoverRight and navigating through the complicated world of Medicare that we all love. To learn more about CoverRight or follow them on social media, we will send those links to you following the class here tonight. Thanks our audience here and also in the lounge. I also want to draw attention to some relevant classes on GetSetUp. If you'd like this event, one of our classes might be of interest to you. Look for the link to sign up for these classes in the chat here on Zoom or live stream, and also at getsetup.org. And remember, everyone who registered, who will receive an email after the event and also the notes. And I'll make sure that you have a link to request any recordings. So we look forward to seeing you again on some future classes that Get Set Up. Thank you and have a great evening. And thank you, Richard.
Thanks, everyone.